Surprisingly, even though it's been around for 7 years, we aren't really on the same page yet on what's even in the Act and what it tries to accomplish. And then how it's worked so far, and what are some of the ways that we might go about replacing it or repairing it. What we're also trying to do with the Teach Out is give people a broad understanding of the Act. Say about 99.9% of the media coverage is on the insurance coverage parts of the Act. The health insurance exchanges that have replaced the individual insurance market, the Medicaid expansions, and to a lesser extent the ability of young adults to remain on parents' policies for a longer period of time. And that's really what gets all the publicity. But the Act also has two other significant components. One component is to try to set up a bunch of pilot programs and experiments to try to transform care to increase the value of care. Can we deliver care more effectively in a more coordinated way so that we can kind of reduce the cost of care in the long run, or at least reduce the rate of growth? And the third area of the Act, beyond the coverage and the transformation of care, is public health programs. Some of the things we'd like the participants to walk away with is just a greater understanding of what their own priorities might be. As a nation, we haven't really had a very explicit and clear conversation about things like what is the government's role versus the private role. Is universal coverage a universal goal, or is that something that we don't see as an objective that we're trying to pursue? When we listen to politicians, regardless of which side they're coming from, they speak as if it's a world without trade-offs. We can have better care, better insurance, and it'll be cheaper, and everybody will have access to it. And unfortunately, cost, quality, and access have inherent trade-offs, and just a greater understanding of what those trade-offs are so that we can decide which ones we're willing to make and which ones we're not willing to make.